Hello and welcome back to GP Video Podcast by Nadia. So tonight I'm going to start a new topic with you guys, which is called depressive disorder or depression. I know that we haven't completed many of our topics, but because I don't want things to get boring, that's why I keep on jumping from one topic to the other so that audience doesn't get bored with just dragging one topic. And because I'm a bit OCD, so I really want to, just cover all the topics in detail. So I will do, so I know that I did some on dizziness and vertigo. I will continue with them tomorrow or day after, but for today I'm starting a new topic. So I have got here John Murtagh General Practice, chapter 10 on depression, which I would like to go through and read it and then explain it as I could, okay? Depressive illness, which is probably the greatest masquerade in general practice, is one of the commonest illnesses in medicine and often confused with other illnesses. So it's one of the biggest presentations in general practice and is actually often confused with other illnesses. Untreated, depression can result in disability and death. The most feared outcome is suicide. It is present in at least 17% of patients who present to general practices and general practitioners, and has a 12-month prevalence of 5% and a lifetime risk of 15%. So 17% of patients presenting to general practitioners have depression. It is often unrecognized, underdiagnosed, yet moderate to severe depression is as disabling as congestive heart failure and with a morbidity comparable to coronary heart disease. Now, this is a very, very, very important line. So it says that as people who have heart failure, depression is as disabling as heart failure. And morbidity means being sick. So sickness compared to people who have had heart attack, coronary artery disease. So just imagine how important is depression. Further, depression is the leading cause of disability for conditions among both sexes, both in Australia and worldwide. So it is equally present in males and females, and both in Australia and worldwide. The lifetime risk of suicide in patients diagnosed with depression is 6%, and treatment halves this risk. So, among 100% patients of depression, 6% people can commit suicide, but with the treatment, it goes down to only 3%. Despite being treatable, 60% of sufferers have not used any form of health service in the previous months. Lack of awareness, stigma, and shame on behalf of the patient contribute to this, which is such a shame again. So people do not go to GPs because they think they would be termed as mental, as just depressed, making depression their choice. It's not choice. It's a medical condition. It's a mental health condition. So lack of awareness, stigma, and shame on behalf of the patient contribute to this underdiagnosis. 60%. So just like 100, if there are 100% of patients in a community, 60% have not used any form of health service. Still, you can see that 17% of general practice patients are composed of those who suffer from depression. So just imagine if all the depression patients come to GPs, then it could just take like the percentage of patients presenting to general practice would go so much up, maybe up to at least 40 to 50%. So this is such a big stigma. This is such a big shame. Of those receiving treatment, 3/4 will be managed in general practice. It is clear that the main focus of activity aimed at reducing the burden of common mental health disorders in Australia is in primary care. So generally, it's the general practice that manages these depression patients. Specialist mental health services play a supporting but not central role. So community mental health services, they do support GPs, but it's the GP's role which is the main, which is central. Depression is a chronic relapsing organic brain disease. So it's a chronic, it's there all the, like, it's not just there for 1 month or 2 months, it's there all the time. Relapsing, so it can go away and can come back. Organic brain disease. Its mean onset is at 27 years of age. However, 40% of sufferers present by 20 years of age. And you would not believe that these days we are getting so many patients in their teens, early teens, presenting to general practice with major depression and generalized anxiety disorder. The average duration of episodes is 3 to 4 months, and 40% of patients will relapse within a 12-month period. The cause of depression is multifactorial, having biological, psychological, genetic, and social factors. Mood disorders in generally have a strong familial tendency, a strong genetic tendency. And the risk of developing a depressive disorder can be thought of in terms of a stress vulnerability model. That is, an individual may have a genetically determined vulnerability, and if enough stress is endured, a mood disorder may result. So for example, if my family members suffer from depression, I will have the genes for it, but it may not manifest until I'm 40 or 50, because I might not have gone through the stressful period. But when I go through a stressful period in my life, be it physiological or medical or mental, then that depression will manifest. Those who are more genetically vulnerable require less stress, but if enough stress is applied, any individual can develop a mood disorder. A significant characteristic is that it impairs thinking, leading to pessimism with negativity and a loss of drive and productivity. So basically what happens in depression is that it impairs your thinking process, which can lead to negative thoughts and a loss of drive and productivity. Now, there are 6 clusters of depressive symptoms, which we will discuss in our next podcast. Have a good night, guys.